Our preliminary evidence suggests that households in rural Ethiopia are facing significant livelihood shocks due to COVID-19. They're coping with those shocks by relying on social safety nets as well as existing savings and existing assets. So it will be very important to track the longer term effects of these coping mechanisms on households' welfare, nutrition, and their broader resilience.
In summary, the effect or the implication of COVID-19 in PSNP household as well as for other unrecognized pools may be higher, and this if the disease is going to be taking longer period, and better preparation is needed from both NGO as well as the government side to respond for the need of those pools. And the other point I wanted to make here is the implication of this COVID. Not now it's only recognize the early effect. So the adoption may need to cover larger portion of the implementation component. So the government as well as our SPIR program has to revisit and see to respond and make more modification.
In Bangladesh, we must consider innovative approaches to protect food security and nutrition during COVID-19. This can include distribution of food vouchers, which we do not have, and combining safety net transfers with nutrition knowledge. Bangladesh achieved the fastest drop in child stunting among developing countries. But this progress is now at risk, so we must urgently rethink our approaches.
While protecting nutrition remain a challenge, we continue to explore innovative approaches to safely and effectively prevent malnutrition, particularly among women and children. There are many opportunities for the government, private sector, and development partners to work together to fight against this global pandemic. And use of technology, as I mentioned, to connect, reach out, and improve the nutrition of the most vulnerable during this critical time.
60% of cash transfers programs are new programs introduced for the crisis, mostly for 3 months. And what this says is that these programs are filling some structural gaps, both at the bottom of the distribution as well as the middle of it. These programs help, but my message is that they are a temporary solution to a structural problem, and that we need to shift social protection somewhat to a new equilibrium in a way that addresses those structural issues. And this will serve countries well in normal times, as well as establishing a pipeline for crisis support during pandemics and other crises.